If a patient can't swallow properly and has a hoarseness in voice and also complain about the irregular heartbeat, then you should immediately think about one nerve, the vagus nerve. Hi, I am Dr. Samreen Firdaus, and in this video we are going to learn about the pathway, origin and the functions of the vagus nerve. Vagus nerve is the 10th cranial nerve. It is the longest and most complex cranial nerve. Think of it like a long electric wire that originates from brain and moves to the neck, and traveling through a neck it goes into the chest and the abdomen. So because it travels a very long distance throughout the body, it is also known as a wandering nerve. Coming on its nerve type, vagus nerve is a mixed nerve. Mixed nerve means it contains sensory fiber, motor fiber, as well as parasympathetic fiber. Our body has vagus nerve on both the sides, one on the left side and another on the right side. So both left side and right side of the vagus nerve combines and form 75% of the parasympathetic nerve fiber. So 75% of the parasympathetic nerve fiber. So there is a very important point to remember. It is a VVI point. Okay, vagus nerve is the main nerve of parasympathetic nervous system. So I am writing it as a VVI point, main nerve for parasympathetic nervous system. Now coming to its origin, vagus nerve originates from medulla oblongata. Medulla oblongata is the lower part of brainstem, and you all know brainstem is a lower portion of brain which is a stalk-like structure that connects the cerebrum with the spinal cord. As you can see in the picture, this brain stem has three parts. Upper portion is the midbrain, pons, and medulla oblongata. This medulla oblongata is the lower part of the brain stem, and from where cranial nerve 10, vagus nerve, originate from these three nuclei. That is nucleus ambiguous, dorsal motor nucleus, and nucleus tractus solitarius. This nucleus ambiguous control muscle of throat and voice box. This is for motor. The second is dorsal motor nucleus. This dorsal motor nucleus sends parasympathetic signal to organs like heart, lungs, and gut. And the third is nucleus tractus solitarius. It receives sensory information coming back from organ. So that is for sensory information. Now after originating from these three nucleus, the vagus nerve exits the skull through jugular foramen. As you can see in the picture, there is jugular foramen showing the exit for the vagus nerve. Now let's trace its journey. As it exits the skull through jugular foramen, it enters into the neck. In neck, the vagus nerve gives three branches. The first branch to the ear and to the pharynx, that is auricular branch and pharyngeal branch. Second to the superior laryngeal nerve, and third is recurrent laryngeal nerve to the voice box and larynx. After passing through the neck, it enters into the chest. In chest, it gives branches to the heart and the lungs. Cardiac branch to the heart and a bronchial branch to the lungs. After passing from the chest, it enters into the abdomen. In abdomen, it gives three branches. The first branch is to stomach, that is gastric branch. The second branch is the hepatic branch to the liver and the gallbladder, and third branch is the intestinal branch. In an intestinal branch, it gives a branch to the small intestine and large intestine up to the transverse colon, that is 2/3 of the colon. So this one nerve touches almost every major organ of your body. You can see in the diagram. Now coming to its function, vagus nerve has a motor function, sensory function, and a parasympathetic function. So its motor function, it helps in swallowing and speaking. Coming to the sensory function, it brings sensory information from throat, ear canal, and internal organs back to the brain. From all these three back to the brain is the sensory function. The third is parasympathetic function. It is the biggest job of the vagus nerve. So its first is it reduces the heart rate, it causes bronchoconstriction, it increases the digestion. So a parasympathetic function means when your body is at rest, that is, you can say rest and digest mode. When the body is at rest, it doesn't need maximum airflow. So by doing bronchoconstriction, that is by reducing the airflow, it actually makes the breathing slow and calm, which helps in relaxing the body. Now the question arises that what is the mechanism behind the increase of the digestion during parasympathetic mode? So when your body is in a stress situation or fight and flight situation, all the blood flow and energy is shifted from gut towards the heart and muscle. And at that particular period of time, digestion pause or stop for some period of time. So that is the main reason why when you are scared or anxious, you doesn't feel hungry, you can't eat, or some of you can also feel nauseous. Now, when the body is relaxed in a calm down state, the blood flow is redirected towards the stomach and digestion starts. So, during that, you have seen that is written in the stomach, motility and secretion increases, gallbladder contraction increases, intestine motility and secretion increases. So, all this process happens once the blood flow is redirected towards the stomach. So now you know why this one nerve can affect your heart, gut and voice. In next video, we'll go more deeper into its clinical relevance and something you heard before about the vagal tone. So subscribe to my channel PhysioSphere so that you don't miss it.